17 Magnesium-filled foods that can lower your risk of anxiety, depression, and heart attacks. Magnesium is a mineral essential for optimal health and proper function of the body. Besides being the fourth most abundant mineral in the human body, it is found out that there are more than 3,750 magnesium binding sites on human protein in the body. To be more specific, this nutrient is essential for the proper function of more than 300 enzymes. This indicates its utmost importance for our biochemical process, most of which are crucial for proper metabolic function. This includes relaxation of blood vessels, proper formation of bones and teeth, regulation of blood sugar and insulin sensitivity, muscle and nerve function, creation of ATP, adenosine triphosphate. Deficiency of magnesium can cause serious health problems. The deficiency of magnesium can cause deterioration of cellular metabolic function, thus leading to serious health problems like anxiety and depression, cardiovascular disease, migraine headaches, fibromyalgia, sudden cardiac death, and death from all causes. This mineral plays an important role in the body's detoxification process, such as synthesis of glutathione. Magnesium is also required for optimization of mitochondria, which is extremely important for cancer prevention. The importance of magnesium for mitochondrial health. Mitochondria are organelles found in the cells. Our organs require energy in order to function properly. That energy is also known as ATP, and it is usually produced in the mitochondria. According to recent studies, mitochondrial dysfunction is the root cause of many health problems. This means that getting the nutrients that mitochondria requires is of utmost importance for our overall health, disease prevention, and exercise performance. Rhonda Patrick, Ph.D., is a mitochondrial researcher who claims that magnesium is essential for mitochondrial health, mostly because the oxidative capacity depends on the ability of mitochondria to produce energy in the cells. How much magnesium do you need? It is considered that a century ago, the daily intake of people was 500 milligrams of magnesium, coming from their daily diet. This is because their food was grown in nutrient-dense soil. Nowadays, the daily intake of magnesium, coming from dietary sources, is about 150 to 300 milligrams. The RDA is 310 to 420 a day. This depends on your sex and age. However, according to some researchers, taking 600 to 900 milligrams is essential for optimal health. Dr. Carolyn Dean claims that you should start by taking 200 milligrams of magnesium citrate a day and slowly increase the dose until you have loose stools. When it comes to magnesium supplements, magnesium threonate is definitely the best alternative. It can effectively penetrate cell membranes, including the mitochondria and blood-brain barrier. Risk factors, signs, and symptoms of magnesium deficiency. The consumption of heavily processed food is the main reason for magnesium deficiency because magnesium resides in chlorophyll molecule. Magnesium can be also lost through stress, alcohol consumption, lack of sleep, and prescription drugs, fluoride, statins, antibiotics. As you can see, these factors have a huge influence of the deficiency of magnesium, so it doesn't come as a surprise that 50 to 80% of Americans are deficient in magnesium. The earliest symptoms of magnesium deficiency include headaches, nausea, vomiting, loss of appetite, muscle spasms, migraines, headache, and fatigue. Chronic magnesium deficiency can cause numbness, seizures, coronary spasms, personality changes, tingling, and abnormal heart rhythms. What are the foods high in magnesium? In order to boost your magnesium levels and to maintain healthy levels, you should include dark green leafy veggies in your daily diet. To obtain their maximum benefits, you can try juicing. Leafy green veggies that have a rich content of magnesium include kale, turnip greens, bok choy, Swiss chard, collard greens, Brussels sprouts, beet greens, broccoli, romaine lettuce, spinach. Other foods that are also a great source of magnesium include avocados, raw cacao nibs and / or unsweetened cocoa powder, squash, fruits and berries, fatty fish, herbs and spices, cumin, parsley, mustard seeds, fennel, seeds and nuts. When supplementing, balance your magnesium with calcium, vitamin K2 and D. Before you start taking supplements, you should understand how nutrients interact and affect each other. For example, make sure to balance between magnesium, vitamin K2, vitamin D, and calcium. When one relies on supplements, it is important to understand how nutrients affect and interact with each other. They all work in synergy, so an imbalance can significantly increase the risk of heart attacks, stroke, and vitamin D toxicity. The ratio between magnesium and calcium should be 1:1. Bear in mind that the need for supplemental magnesium should be 2 times greater than calcium because you can easily get more calcium from your diet. Dr. Kate Riam-Bluey claims that for every 1000 IUs of vitamin D you take, you need 100 micrograms, mg, of K2. When it comes to your intake of vitamin D, it is recommended to test your vitamin D level 2 times a year in order to find out your personal dosage.